So for the record, Dr. Vern Saboe, representing the Oregon Chiropractic Association. And given our history of provider non-discrimination language we've gotten into Oregon law, my comments are actually questions, and that is relative to not discriminating against healthcare providers in this proposed universal health plan as it pertains to participation, coverage, and reimbursement. What we've got in Oregon law is currently, so it's my first question is participation. Is it the presumption, the goal of this, of the plan to have it to be an any willing provider provision? In other words, any provider willing to follow the statutes, rules, guidelines, pathways would be allowed on the state's panel? That's question one.
That's outlined in our statute, yes. But any provider who's licensed and in good standing in the state is eligible to participate in the plan. That's in statute, yes.
Great, great. And then coverage, if it's a covered health benefit under the plan and a healthcare provider, not the least of which is a chiropractic physician, provides it, then the state must reimburse them for it. You're not going to say, well, we generally don't pay chiropractic physicians for this or that intervention, that service, even though it's in your scope. If it's in our scope, we provide it. It's going to be, we're going to be reimbursed for it.
Right. I think that's the language. I'm not going to be able to put it exactly, but it says any licensed provider providing benefits that are available under the plan
Right.
or get paid by the plan. Yes.
Well, we've got an administrative rule relative to the commercial health insurance that really spells it out. So, and then the last piece is reimbursement. And this has been a real contention. That is reimbursing us all for the same covered service. We provide the same service. You pay us all, no matter what the type of provider is, you pay us all the same if it's within our scope, but can vary reimbursement based on quality or performance measures, outcomes. And of course, the idea is to improve quality of care to Oregonians. What say you about that?
Well, so we haven't taken up that issue yet.
Okay.
Our plan design committee will be discussing provider reimbursement strategies, including a quality strategy in coming meetings, but that hasn't been tackled yet. So yes, we're far from a decision or any input on that yet.
Well, that's something that's very, very important to us. So all the complementary alternative medical providers. So thank you.
Yes, thank you very much.